There's disruption. They're doing everything that they possibly can. And last week we started off the show by saying, this week we're saying Republicans and Democrats. Last week I think we hit it on the head. Them that got against them that don't.
Yes. And the most disturbing thing when I speak with advocates in the community here, throughout the state and throughout the nation, one of the most disturbing things is this pitting of families against old people, or young people against old people, or disabled against the children. And that's what's the most disturbing, and it raises the issue of messaging, Paul, how health care reform should be messaged so that we don't obfuscate the real facts about what are the cost of inaction versus the cost of action. And that's something that I know we're going to talk about a lot today, and just getting these facts out to folks. Your deductibles will rise if we do nothing. And we know deductibles have been rising exponentially since the beginning of the 1990s.
Let me ask you to hold that thought and also prepare another trend of thought. I'm going to ask you, because you mentioned something, Tracie. What's the best way to simply and simplistically get that message out? The message that we need health care reform, and how it's exactly going to hit people. We're going to take a break and come back and deal with that and some other questions on health care reform. Welcome back to Table Talk. We are discussing health care reform. Will it be the victim of partisan politics? And when I say the victim, I don't necessarily mean it'll be voted down, not with the Democratic power in Congress, but will we reach a stalemate? Will nothing happen again? That's one of the things that that concerns me. But back to the point we left on the table before the break. How do you simplistically, I'm not asking a lot of you guys, but how do you simplistically say to the people, this is what we're talking about? I mean, because Tracie, you brought me some stuff today. Might take me 2 weeks to read and digest. So I'm putting it on YouTube. How do you simplistically say to people of all ages, this is what we're talking about?
Well, we talked about this before, Paul, and let's go back to it. Obama started as an organizer. He's an attorney, but he's an organizer. I'm an organizer. What you need to do is not stand as Democrats and Nancy Pelosi telling the story of health care coverage. You need Tracie Washington. You need that person who does not have health insurance coverage telling it. The most effective ad I've seen run by Democrats was an ad featuring a small business owner discussing the fact that he could no longer cover his employees because of the rising cost of health care. So you get a family member to come in and talk about diminishing coverage and give those same facts. Talk about the fact that on average, middle-class families with private health insurance pay $4,400 a year on health insurance premiums. That's the average middle-class family. So you get that family out there talking about that burden and what that means and how health care, how they've reduced their ability, or how their ability to have health care coverage in their family has been dramatically reduced. And we have the statistics on how folks are delaying. We have statistics on how folks are delaying health procedures because they can no longer afford this. But it is truly a situation where we need to not have so much the politicians telling the stories, but those individuals telling the stories, one. And then number two, and I believe this firmly, we got to take back control of these doggone town hall meetings. Exactly. Too often we've allowed, and I'll call them the kooks and the crazies, to go into these town hall meetings and start talking crazy. Oh, we're going to have a death tax, and we're going to have these death panels deciding. Well, if somebody came up and, goodness knows I'd never get elected to Congress, but goodness knows if I was standing up there in front of a group of people and someone said that to me, I'd say, ma'am, surely you're not delusional. Surely you cannot believe that the federal government is going to have a death panel decide whether you live or die. You just can't believe that, and if you do, I'm sorry. Somebody needs to help you. And then I'd move on. Does anybody have a real question here? And we have to treat, I know it's fine, and Democrats are very good at being politically correct. We got to stop that now, because it's harming people when we try to be politically correct and pat people on the hand and say, I'm so sorry you believe that. Let me help you not believe it. We need to call them crazy, Paul, because they're crazy.
Tell them what it is. Well, And that's exactly my point. Blayne, I asked you, is whatever the message of the Democrats, have you been able to define and discern a clear message from the Democrats, and is it resonating among people?
Well, I think, yes, there is some clearly defined highlights, but I think the Democrats have to, as Tracie said, they need to get back into these town hall meetings and take control over them, first of all. They need to make it, it's the old KISS rule. Keep it simple, stupid. Mm-hmm. Make sure that when people walk out of there, they're not bogged down, excuse me, Tracie, with lawyer. Mm-hmm. They just need to know exactly what the bill is going to do for them and what it's not going to do. Mm-hmm. And at the end of the day, they need to dispel all of the rumors that are being put out and say, look, we're not going to have a death tax. We're not going to force you to, choose to die when you're 65. We want you out of here by 67. Things like that, they just need to dispel. Right. But that's what's making the headlines, and people are confused. They're genuinely confused. And I think pretty soon, one of the things that's been announced is that the pharmaceutical industry is on board. Of course, they would be on board. Mm-hmm. More people with insurance means what? Right. More medicine. Right. So of course, they've already struck their deals with Congress, and they've decided that they will foot part of the bill that'll be passed on once this legislation is eventually passed. But they've also decided that they're going to put out $150 million to $200 million in ads, and I think that they will probably do some of that heartwarming, heart-touching advertisement that Tracie was talking about. But what the Democrats have to do is just keep it simple and make sure that when people walk out of these town hall meetings or after viewing one of their commercials, they know what healthcare is all about, and they can pretty much sum it up in a few things. And they just need to make sure that they sum it up in those advertisements and sum it up in those town hall meetings.
One of the things that's being pointed out is, people are saying, well, look, I'm paying for my health insurance. Why should I also pay for somebody who doesn't have health insurance? Why should I subsidize that word, subsidize somebody else who doesn't have? I work for mine. Mm-hmm. How do you respond to that?
Well, we respond to it once again by getting people there with the facts. And we have someone, again, not the congressman, but have an individual who is having health insurance coverage basically by an employer, talk about the fact that, yes, I am grateful that I have health insurance coverage by my employer. Last year, I paid 2 years ago, I paid $4,000 a year for that coverage. This year, I'm paying $5,000 a year for that coverage. And I anticipate that coverage will continue to escalate because I have less access to affordable coverage. Think about the fact that in Louisiana, 71% of our health insurance, private health insurance, is covered by two groups. Mm-hmm. So we need to have those people there saying, I would like another option. And maybe that other option is a public option where I can shop in a market and be able to compare. Here's what I can get and here's what I have right now. And I want to weigh these things. Mm-hmm. Again, President Obama, the best thing I heard him say is, I'm straight. I got some of the best insurance coverage in the United States of America, and 535 individuals here in Washington in the Beltway have some of the best insurance coverage ever. As Americans, you should want this same thing. Now, of course, folks are saying, wow, this is going to cost me more money because I've got to cover those 50 million other people who are not insured. And then we need to also message by having one of those people who 2 years ago had a job and was covered by an employer, Blayne, come back in, and you've got those statistics say, well, I've lost my job.
Right. Well, over 45 million Americans are uninsured. That is a well-known statistic. It's not going anywhere. But according to the White House, the average family who has private insurance already pays a hidden tax of about $1,000. They're already contributing to it. The Obama administration needs to make sure that they get the message out that this is not going to increase the average person's health care insurance because of taxes that are associated with covering uninsured people. But this is one of the things that the Republican Party is continuously beating the drum on and continuously putting in the back of people's heads. And the last thing that people want is to spend more money. In fact, this is one of the sticking points of health care reform, reducing the cost. So the minute that someone says it's going to cost you more money, red flags go up automatically.
Does anybody